Welcome to my new class. So today we will discuss about the adverse drug reaction. So in previous lecture, adverse drug reactions, it can be defined as the unwanted, the undesirables, and you can say the unpredictable reaction which is occur due to overdosing is called adverse drug reaction. Adverse drug reaction, it may be in the form of teratogenicity, which is called induced birth defect, capacity of a drug to cause fetal abnormalities, for example thalidomide. So this is the drug, due to use of this drug teratogenic effect, there may be developmental abnormality. The second one is mutagenic effect. Mutagenesis involve the alterations of the genotype by the modification of the DNA. How so mutation is carried out to the next generation. So mutagenic effect is also another form of adverse drug reaction which may be occur due to use of drug. Drug may cause photosensitivity. For example, let's suppose cutaneous reaction resulting from drug-induced sensitization of skin to UV radiation. For example, quinolones. So quinolones, we know that quinolone belong to antimalarials. Quinolones, anti-malarial drugs. So it can also cause photosensitivity. Now come toward drug safety. Drug safety or therapeutic window. It can be defined as therapeutic index or therapeutic window. It measures how the safe is drug or the margin of safety is called drug safety. Or let's suppose if a drug, it is high therapeutic index, so it means that the drug will be more safer. If the therapeutic index of the drug is low, so it means that the drug is not safe. So larger is the therapeutic ratio. So let's if the therapeutic ratio is larger, so then it means that that drug will be more safe. Therapeutic index or ratio, it can be defined as, in pharmacology, therapeutic index is defined as it is the ratio between lethal dose and effective dose. Lethal dose can be defined or it can be represented by a capital LD, and effective dose can be represented by capital letters ED. So this is useful measure of safety and efficacy of any drug. Or in another word, therapeutic index can be defined as mean lethal dose divided by the effective dose. So it tells us about, through therapeutic index we can easily determine the measure of the safety and efficacy of any drug. This is lethal dose. Lethal dose can be defined as it is the amount or the quantity of a drug which can kill the person's individual when it is administered. So it is called lethal dose. So lethal dose, especially in case of overdosing, so there may be chances of, you can say, it may kills the subjects when it is administered. Another one is effective dose. Effective dose can be defined as it is the amount or the quantity of drug which remove the sign and symptoms of the persons which it can be administered. So effective dose. Placebo. In pharmacology, placebo can be defined as the drug which devoid of intrinsic pharmacological activity and it works by psychological mean. Uses placebo, actually you can say this is not, let's suppose if you have a capsule of diclofenac sodiums, and you know that this diclofenac sodium, so it contains diclofenac potassium. Let's suppose if you can use another capsule and it remain empty, and I think there is no chemicals, ingredient or constituents, the exact constituents are not present in that drug. But after administrations, it means that in pharmacology, placebo can be used to satisfy the patient psychologically. In order to satisfy the patients psychologically, actually these ingredients are not present in the drug, but just to satisfy the patient. In order to satisfy the patients, we can use this term placebo. Now these are the phases of clinical trials development. The first one phase is clinical pharmacology, the second phase is clinical investigation, the third one is formal therapeutic trial, and the fourth one is post licensing or marketing studies. Like in pregnancy consideration, increase the maternals you can say heart rate, cardiac output, and blood volumes. It may affect the absorption, distribution, effectiveness. Drug may cross the placenta, and drug may cross into the breast milk, or teratogenic effects. These are the pregnancy categories. So category A, B, C, D, X. There are 5 categories. So in first category A, this is actually controlled studies. Control study in pregnancy, this is less than 1%, while in the second case, animal studies have shown no risk and inadequate human data, while in category C, the animals study show no risk, inadequate human data, while in D, and you can say in humans, and D, category D, the human data show no risk, but benefit may be outweigh risk, while the category X is animal or human data positive for risk, use or unwanted. These are the pediatric considerations, that orals absorption increase or decrease, thinner the skin, and topical absorption, the plasma protein concentration, pre-protein bound drug availability, and extra fluid in neonates. So this sign is used for decrease and this sign is used for increase. So here the oral absorption decreases and the skin become thinner, and you can say topical absorption increase. So the plasma protein concentration decrease and pre-protein binding drug availability enhance. The extracellular fluid in neonates increase, and it can alter the metabolic rates, while the elimination or metabolism decrease. BSA and weight based dosing important. The oral absorption decrease, the plasma protein concentration decrease, the muscle mass decrease, and body fats increase, while the liver and renal function decrease, and multiple drugs and multiple disease. Inshallah, in next lecture I will tell you about the fundamental of pharmacology. Thank you so much.